Hey friends, welcome back to the show where we talk about all things jaw, sleep, and face. And yes, sometimes even why your jaw sounds like popcorn when you chew. We all love that popcorn sound, especially when it comes to Thanksgiving dinner. And we're all sitting there and you've got this popcorn sound going on in your jaw. And everyone looks at you while you're eating your turkey and your stuffing. So let's talk about popcorn sounds in our jaw joint. I'm Dr. Gunnarsson. I'm the TMJ Sleep Therapy Center of Utah. And I'm here with Mindy, our myofunctional therapist. TMJ and TMD sound like fancy words and fancy acronyms, but we're going to break it down for you. So let's first understand what the TMJ is. TMJ stands for temporal mandibular joint, and that is your jaw joint. It is one of the most complex jaw joints or joints in the body itself because it's actually two joints that have to work together the whole time. And so it becomes very complicated. It not only hinges like other joints do in the body, but it also glides. So it kind of, in a way, leaves the socket site and moves forward so that we can open up really wide to eat those delicious triple stacked hamburgers that we love to eat. No, but we get those that come in the office. And one of the biggest things is I can't eat a hamburger anymore because they're locked closed. And so one of their most exciting moments in treatment is when they can finally eat that hamburger. So understanding what TMD is temporal mandibular disorder. And it's kind of like an umbrella of a whole bunch of disorders that go along with the jaw joint. It could be disc displacement. It could be the popping and the clicking. It could be just soreness, headaches, neck pain, jaw pain, all these things that all encompass that part of that TMD. And so what we do in our office is called non-invasive decompression therapy. Non-invasive meaning that we try as much as possible to stay away from surgical techniques with scalpels and needles and all those fun things that make us all excited to go to the doctors and to the dentist. But we try and stay as much as possible away from those things. There are times when we may use needling in doing some different techniques as far as pain goes. However, for the most part, we try and do non-invasive decompression therapy. It's just the fact of moving gently the jaw joint out of place just ever so slightly to give enough room that you're not impacting it every day while you're chewing. For 12 weeks, we take you through a process of having that decompressed in the area. We can't put you in something like a sling. We can't put you in a knee brace. We can't put you in an ankle brace for a sprained ankle. And so when it comes to work with the jaw joint, we still have to allow you the ability to chew and the ability to talk and to swallow. And so all those things are very important. And so we try to, in the best way possible, through non-invasive decompression therapy, fix the jaw joint. So, Mindy, you're the myofunctional therapist in our office. How does myofunctional therapy play a part in this?
When your jaw is in a compressed state and those muscles are working in that compressed state, those neuroconnections in the brain are forming those habits and patterns for those muscles to continue working in a state that would keep it compressed. And since we want to decompress it, we need to make sure that we're getting those muscles working in balance. And sometimes one side is working harder than the other. Sometimes the lips aren't working correctly, and sometimes the swallow is dysfunctional, which is leading to those muscles being compressed. So when you're in an appliance that is allowing you to be decompressed and you're working with muscles to work in a decompressed state, you're retraining your neuroconnections in your brain so that eventually those muscles start functioning in a more correct habit forming to keep you in that decompressed state.
That's right. Every time we swallow, we use muscles to compress and bite down. Every time you swallow. And I never realized that till I went to one of the courses on TMJ. It's like, yeah, every time you swallow, you're actually compressing that jaw joint. And when we get into habits of what we call parafunctional activity, where we're using grinding and clenching our jaws at night because we can't breathe and we don't get enough airflow, that just damages all of that. And what you do is retrain all those muscles. I mean, it's nice that we can decompress it, but you're the one to retrain it so that it all functions normally.
Right. And it's not just muscles in the jaw and in the neck. We also oftentimes work a lot with breathing because the diaphragm is really important for sleep. And when it's not functioning properly, can lead to sleep issues like that lead to the clenching and the grinding issues as well. And sometimes myofunctional therapy involves breathing exercises as well.
a lot of the things that we do in non-invasive decompression therapy, we do a lot of different things, a lot of complementary things that go along with it. It's not just the fact of an orthotic device that decompresses your jaw joint. And a lot of people like to think of that. They're like, well, can I just order this, or can I just order that, or can I just order this? The whole thing it all works together. When we come up with a treatment plan for you, it is a comprehensive treatment plan. And you can't nitpick out which portions you want to do because it doesn't work that way. It's like cooking something at home and say, well, I don't have these 4 ingredients, so I'm not going to include them in. It's just not going to turn out the way it's supposed to turn out. So along with some of these complementary therapies, things that we do along with it, one is it's called an SPG. Now, we get a lot of people who have a lot of headaches and migraines that come in the office, and the SPG it stands for sphenopalatine ganglion, and it is a neural center directly right behind your nose. And when we go in and we infiltrate that area with some anesthetic, it makes those migraines just melt away. And that's literally what people tell me, is that they get this tingling sensation as the migraines going away. So I think that's really exciting. And then they don't have migraines for at least 3 months. And we try to only do that procedure after we've worked with them in seeing what we can do as far as just a non-invasive decompression therapy. How much is that actually benefiting you? How much is that getting to you to the point where we can, do we still need to go into this SPG?
We do an anti-inflammatory diet. A lot of inflammation in the things that we eat can contribute to inflammation in our joints. And like was mentioned earlier, our jaw is a very complicated joint, and inflammation in that area can lead to pain and discomfort. So we do need to incorporate an anti-inflammatory diet for most individuals. And then stress management. They do stress management. A lot of that can be controlled through breathing. So we do some breathing training with stress management. We may not necessarily call it, you're going to have your stress management therapy today, but it's all incorporated in the different types of procedures that we recommend and exercises that are given as individualized therapy, and that goes along with the myofunctional therapy and posture correction. Posture isn't just about the spine. There's correct posture.
Or I can be sit straight in my chair.
Well.
As we're talking about posture, I have to sit.
Right. But even our tongue needs to be in correct posture because it is part of the whole system. So yeah, those are some of the complementary therapies that I can think of on the myofunctional therapy side.
There's some others. So going back to the anti-inflammatory diet, I like to tell the patients that the reason why we do the anti-inflammatory diet is to decrease inflammation in the jaw joint, of course. I mean, we're trying to get that back to what you normally, but how can we focus on an area of your body and try and fix an area of your body when you got inflammation going on all over the place? And so we need you to stay really, really stick with that diet when we present it to you, because that is such a big, big part of it. So is that, like you were saying, myofunctional therapy, that breathing. Stick with those breathing exercises, those stretching exercises. Those are so important also. Such compliance. When we get the compliance in these things, we see such a high degree of success. Some other things that we do are prolotherapy, and that is where we take and we do an injection directly into the jaw joint. If you're locked and it's not unlocking, sometimes we do have to go into that jaw joint and give it a little bit of extra cushioning in there, just to separate it down just a little bit and give you a little bit more room for that disc to slide back where it needs to go. So we do something called prolotherapy, and it's very gentle. It's very gentle. Another item that we use is called a cold laser, and we like to call laser therapy. There are different degrees of lasers. There's cutting lasers, non-cutting lasers, and then we have what people can get off the internet, like red light therapy. So going back up into the big laser stuff, we've got lasers that cut and lasers don't cut. And the ones that we use for our treatment in temporomandibular joint disorders is the ones that don't cut, but they do go into the tissues and cause some effects in the muscle tissue. They cause relaxation of muscle tissues. They cause an increase of blood flow into the area. They also affect the mitochondria in the cells, so you get a lot more cell division going on. And they also speed up the process of inflammation. So by doing that, inflammation can be a good thing for the body. It can be, and it is helpful, but only when it's controlled. When it gets out of control, then it's not as helpful. So when we can speed up that inflammatory process and get the effects of it sooner or quicker, that's all the better.
But you could see that there's a lot more than just wearing an appliance when it comes to decompression therapy. If you want good results and you want success, you really need to do more than just put an appliance in your mouth and expect that that's going to work, because there's so much more to it. It's a very complicated joint. It's a very complicated system with our body. And so we need to look at the whole body as a whole as we're working with those issues that we're trying to address.
One of the benefits that you'll see,
Right.
less neck pain, shoulder pain, less headaches, fewer headaches, jaw able to open wide. One of the biggest things that patients will tell me that benefit that they got was the fact that they could yawn. And you don't realize how much you miss these. These are such small things, but when you're locked closed and you can't open wide, yawning becomes very difficult. And when we finally unlock you to the point that you can yawn, it is such a relieving experience to feel that yawn.
Right. Well, and along the lines of the yawn and being sleepy and tired, I've had a lot of people telling me that they're able to fall asleep a lot faster and they sleep more soundly. When they wake up in the morning, they're feeling more refreshed, which are all really important things. Sleep is such an important part of healing therapy with anything. So improving the quality of sleep by getting you out of the pain, by getting you to fall asleep faster and to sleep more soundly is going to allow your body to heal.
Yeah. So we frequently get asked questions about why not do surgery? Right. Why not just jump in and do the surgery off, right at the beginning? And it is and we talked about how complicated that jaw joint is, and it is a very complicated issue. When you're going in and doing surgery, you have to do it on both joints. You can't just do it on one side because those work together and function together. And the success rate is very low. One of the things that we're trying to work towards when we're doing this non-invasive decompression therapy is to decrease the amount of pain that you have in your body. And we all know that when you go through surgeries, that you don't always have a decrease in the amount of pain. You still have some discomfort that never completely goes away. I know we like to laugh about it, but we can usually tell you when it's going to rain or it's going to snow based upon the aches and pains that we have in our body
from previous injuries or surgeries.
Right. So we've had some great patients. Just to share one story with you that I know of is a patient who was about to lose her driver's license, and she was about to lose her driver's license because of the pain,
the headaches she was experiencing.
Yeah, headaches and a lack of sleep that she was experiencing, and through going through treatment with us, she was able to keep her license. Her headaches are now gone. She doesn't experience them anymore, and she gets perfect sleep every night. She just feels so refreshed in the morning.
Yeah. And then I've had a patient who has been working with me before she has received her appliance therapy and has already started to see improvements in her jaw just by holding her mouth closed and breathing through her nose. Dysfunctional habits, those parafunctional habits can lead to dysfunction in the muscles. And just by correcting those parafunctional habits can start to make some improvements, and then continuing on and being compliant with all of the therapy needs can get people out of pain completely or so much more functional that they don't notice if there's any discomfort at all. It's maybe at a 1 at most. Yeah. So we get a lot of success.
So I have to admit, I'm a little bit jealous because it takes a little bit of time for us to get the orthotic appliances, and before we get those and we start applying all that, we have you go through the sessions with Mindy and going through breathing sessions. And a lot of times when we finally deliver those orthotic devices, patients say, I'm already sleeping so much better. I'm already feeling so much better, because breathing is literally so important. And when we get you breathing through your nose, there's less clenching going on. You're able to sleep better because your body's not suffering from lack of oxygen. So it's just, I get a little bit of jealousy, going on there because they're already starting to feel better before they even get to see me and we start treatment. Right. But I want to thank you for joining us today. And Mindy for being here with me. It's great. We love working together in the office. And thanks for joining us for all things TMJ Unlocked and all things TMJ related, headaches, discomfort, pain. And we look forward to sharing stories with you again and some more podcasts.